Good morning, Singapore, and welcome to the biggest and best breakfast show in Singapore. We are The Big Show, and today we have as our guest award-winning psychologist from the therapy room, Dr. Geraldine Tan. Good morning, Jerry.
Good morning.
Good morning, Dr.
Morning,
Jerry.
Jerry.
You're looking lovely today, and we're talking about triangulation.
Yes.
So
and it's not the math triangulation.
Oh, I thought it's when you get 3 points and try and find your wife because she's lost.
No.
You triangulate where she might be.
So what is triangulation?
Triangulation in psychology is to triangulate a person into a quarrel, a situation, and it's not very pleasant. And I suspect that many of us have experienced this at one point or another, whether at work, at home. You know, it can be very simple. It can be like you're talking to your friend, right? You're having a conversation and you're giving an opinion about something and you go, hey, you also agree, right? It can be as innocuous as that.
Wow. Okay.
You know, and the person feels compelled and obliged to agree with you, but then alienating the other party that is in the conversation.
So are there always three, I beg your pardon, are there always three people involved in triangulation?
There are three parts.
Parties,
that means
right.
the person, at least three groups or three parties. So there's one person that would do the triangulation, trying to ally another group, perhaps, to set that group against another group. It is also possible.
So two people taking two parties or 2 points taking the same side, alienating one other. Okay, got it.
I'll never be
Yes.
caught in a situation like this. You know why?
Why?
Too complicated. For me.
No, but I can see it happening. I can see it happening in quarrels where you
Yes.
try to get people on your
Yes.
side.
Yes.
That's
know what I
not
mean?
that's not a good thing.
Yeah.
And sometimes it gets a little bit more cynical. So we'll talk about the more cynical one later on. But, you know, we've got
Excuse
into
me.
such situations at one point or another, you know, with our friends, with our family members, you know, parents trying to get one of the children to agree with them. Yeah.
Is it always a negative situation though? Can it ever be positive?
If it's positive, we won't be talking about it. You know, everybody come, let's enjoy ourselves.
Okay.
You know?
Okay.
But can it be good and you be triangulated? I don't think it would be called triangulation then. The triangulation is a little bit more negative, a little bit
Negative.
more cynical.
Sounds very political.
It does sound very political.
I'm sure political parties use triangulation,
I'm
no?
sure. So triangulation is a term that is not a disorder, it's not a diagnosis, but it's a way of doing things. So yes, I suppose it can be applied in different situations.
Okay,
it.
let's continue to talk to Jerry on The Big Show TV. Meantime, here's Love, All for Nothing on Kiss 92.
So Jerry, triangulation. How? So you're saying it could happen in the home where mom and dad are having a discussion and you pull the kids in and try to get them on your side,
Yes.
forcing
Yes.
them to choose.
True.
Ooh.
True. So it could so if
That's
we
not
move into
nice.
a little bit more you know, cynical, it could be, oh, if you don't agree with me, it means that you don't care about me, you don't love me, you know, and that whole talk about why did I bring you up? You know, you should be in agreement with me. Yeah.
Emotional blackmail.
Yeah.
Emotional blackmail.
And I see a lot of that happening during divorce.
Yes. So
Right.
during divorce, there's something called parent alienation syndrome, PAS. It is not a disorder that is in our books. It's not something that we diagnose. So it's very difficult to prove or disprove in court, but we can always raise it up. But it's very terrible when children are caught in this situation because children are being fed from one parent to the child that your other parent is so horrible, so bad, and basically alienating the child from the other parent and telling falsehoods, gaslighting.
Okay, Kiss 92 listeners who are in that situation right now, this is the chance for you to ask Jerry some
Your
questions.
Yes, please. Yeah.
On our Facebook or Instagram or YouTube. Okay.
Yeah.
Because I actually have a question for Jerry. Jerry, as a psychologist, have you ever been into court in a divorce situation like that where the child has been forced to choose between parents?
So I don't go into court. I see the children, and it's really difficult because sometimes we also get into that whole triangulated space, and it's really not nice. One parent would say everything bad about the other parent. The other parent would say, I didn't do it. So both parents appear to be victims. And we have to then check in with the child, observe the child, do therapy with the child. So we basically see the child for a few sessions, interview the parents, and then try and find out the actual story, which is sometimes not forthcoming, and sometimes the children are really afraid of the parent. That means the parent is trying to do the PAS. And the child is stuck because already the loyalty is split. But when they are caught with one parent, and this parent is so dominant and feeding them all these, what are they supposed to do? They are with that parent. In order to survive with that parent, they have to adhere because they are still dependent on the parent.
Couldn't triangulation actually work in a good way? Just to give you an example, parent wants to live on their own even though they're old and frail. One child says, no, why don't you come live with me? That child then garners the support of the other children, or the other child, you say there are two kids, the other child to sort of convince that parent to move in with the child. Isn't that positive triangulation?
Well, that's not triangulation. So triangulation
That's an
has
intervention.
Yeah. So, intervention, or like you say, it's a very positive thing. Triangulation has this notion, this concept of I want to exclude you. And there's that threat there, and some manipulation. So it's a more cynical sort of idea.
I get it now.
Actually, I'm thinking about these situations, right? I mean, why is it so difficult, like for the courts, for example, sometimes, right? As in, like, if they are to determine who the child is going to be living with, let's say, who's going to get custody.
Care and control.
I think at the end of the day, what the court needs to do is just ask the kid, who would you like to stay with?
They do. But like Dr. Jerry says, and I've seen a lot of situations like this, Dr. Jerry says the child gets convinced by the more powerful parent, because there's always one more convincing parent,
Right.
that you are going to come with me or else. You know what I mean? You're not. There's a lot of that threats that go on.
If you stay with mommy, you're not going to see me. You might see me once every 14 days.
if the child falls for it, then okay, so be it.
No, but
because if not,
it's not always for the best of the child.
I think whatever it is, just leave it to the child.
No, the child cannot make that
decision.
choose.
No,
It's
You know what I
actually
mean?
very difficult, Glenn.
Yeah.
I'll explain a situation that I was in. So I was dealing with parent alienation, very clear cut to me. Father was alienated. Mother was the one looking after the child. This child is maybe about 10, 11 years old, or maybe, 10, 11 years old. So not very old, very dependent on the parent, right? Either parent that takes him. And the mom realized that I was picking up, certain vibes. And the child was telling me certain things. So she did this. So I got triangulated where in parent alienation, where, if the parent that is doing the PAS realize that you're being an ally to the other parent, they will start to also park you in that category. So I was parked in the other category, the other camp, but the courts had wanted the child to be assessed and seen. So what this mother did, was to then ensure that she arranged for a play date with the child on the same day that I'm supposed to see the child.
So that you couldn't see her.
So that she brought him, and he's very angry that he has to come to me, and she
Because
will go,
it's played it.
see, you have to come to therapy. I don't have a choice.
You miss your play
But
date with your friend.
He's missing his play date. So he always comes angry, and Auntie Jerry becomes the
bad person.
enemy. Yeah. So she can engineer.
Very
So this-
manipulative.
Yes.
Yeah, parents
at
can
the
be so
end of the
awful.
day, I can't see the child. Yes. Or I see the child in a state where he is so angry, I'm unable to get any information whatsoever.
So it's because
Because-
of you that I'm not getting to
Yes.
play with my friends.
So you see, I'm saying the
Yes.
kids
So
are very smart,
manipula-
no? Just leave it to the kids.
They're
No,
not.
they're not.
The kids
They're
are
being
very clever. It's
manipulated.
like, who do you want to be with,
They're not
mommy or
old-
daddy?
they're not
I
old
want
enough
to
to
be
make
with
that
mommy.
decision.
Okay, you
Traffic,
stay with
traffic.
mommy then. Welcome back to The Big Show and The Big Show TV. Our guest for today and every Tuesday is Dr. Geraldine Tan from the Therapy Room. And today we are talking about strangulation. Triangulation.
Triangulation. So, Dr. Jerry.
When I was doing it, I knew you would come up with strangulation. I was like, okay, let me wait for it.
Because sometimes, because of triangulation, you feel
like
strangling someone.
Yes, it's true. It's true.
So, Dr. Jerry, you were talking about triangulation in the home, especially when it comes to divorces and parents using the kids and their emotions. What about triangulation at work? Does that happen?
At
It's
work,
got to.
of course, it does, and sometimes it's in the most devious or dirty way, right? Because one of the it just takes one person to then split the team, as we call it. So you tell one party, you spread a rumor, right? You tell one party falsehood about another team, and the other team is how bad, or the other group is how bad, and that how victimized you are or how bad you are. And because it is so bad, this group of people, this person does not verify with the other party. So what happens is then you get two camps. You split the team, you split the organization, you split the company. And, things, well, we all have our responsibility. Work gets done, but the dynamic starts to shift, and it's not very pleasant.
Been there.
So how do we prevent triangulation? Because you were saying if the one team doesn't verify whether something is the truth, then obviously things are going to get triangulated. But how do we prevent that?
So good communication. So one big thing that you hear, right, is good communication to verify with the other parties. If I were to look at even in the therapeutic setting, so in the hospitals, we have had take one group of them eating disorder clients or eating disorder patients in the hospitals. They would tell their attending doctor one story, speak ill of the nurses, and then tell the dietitian something, but tell the therapist how bad the dietitian is. So we are all like not in sync anymore. The entire team that is supposed to look after the patient gets split.
Right.
But I mean, it's well, no.
Okay,
Karen.
let's continue to talk about this on the Big Show TV. The time is 8:18.
Professional setting like that, I mean, the patient is the most important part of the puzzle, right? I mean, that kind of thing shouldn't happen.
Yep. But if the patient wants something, and say, perhaps I don't want to eat, eating disorder, anorexia, I don't want to eat. And they say, oh, but the dietitian is being such a, and they love to use the F word, the B word, whatever it is.
Wow.
And young adults or young teens, their language. And they would say how bad this person is to prevent them. And they are very intelligent, so they come up with all the different logics. And, we're sitting there and trying to say, okay, we'll talk to the other person. Oh, you don't need to. I've already spoken, and it doesn't get through. And the mood deteriorates, so they start to have depressive symptoms, or it does comorbid with depression. So then we are inclined to say, oh dear, you're put in such a difficult position. So if we don't start talking, so if the team does not start talking, then we are inclined to believe the patient, which Angel has rightly put, is the key person in this situation and is the one that has most say.
Yeah.
The most powerful one.
Jerry, triangulation in therapy, right? You were mentioning just now that child with the divorce and how the mother put you in the other camp. Very interesting.
Yes.
Matthew has asked the question: how do you then handle that? What do you how do you settle that problem
as a therapist?
Yeah, so we can only submit what we have, the information that we have, and it's so once we write the report, it's up to the judge to make that judgment call.
Do you include things in the report like the mother, this particular situation?
Yes.
Yeah, you do.
Okay.
Yes.
Saying that she purposely arranged for something else so that the child
I didn't say she purposely. She arranged it.
You say she arranged. She did it on purpose. No, she did it on purpose. That's for sure.
I mean, we all
So
know
clear.
that.
She did it on purpose.
Okay.
Because if it occurs once, it may be a coincidence. She did it 3 times.
Yeah.
Oh wow! So then the judge will take a look at all the whole situation and make the judgment for himself, right?
Yes. Yes.
So wait. So we're talking about family court here, is it?
Yeah, family court.
Because there are different types of
Yeah.
courts.
Yeah.
So
Yes.
this is a
Family court.
family court.
Yeah,
Family
Yeah.
court.
this
Yes.
comes under MCYS. As well, yeah.
Jerry, what kind of people triangulate? Are they manipulative? Are they people who lack confidence and need to build a team around them?
Low self-esteem.
Low self-esteem. What sort of people are they?
Absolutely. So they are very insecure people. So most of the time they cannot stand on their own. They don't trust themselves. So they need to pull other people in on their side. Those with personality disorders. So you have the antisocial personality disorder, narcissistic personality disorder, histrionic personality disorder. What else are there?
They're pusillanimous.
What's that?
That's a new word.
Yeah, it's a new word.
It's our word of the day. They're pusillanimous. So this is particularly for a man, destitute of a manly or courageous strength and firmness of mind, of weak spirit and mean-spirited.
P-U-S-S-I.
No, one S.
Oh, P-U-S-I-L-A-N.
Double L. One S, double L. Yeah.
M-O-U-S.
Correct. Something like that, yes.
Pusillanimous.
Jerry's actually writing it down.
It's an
Pusillanimous.
adjective. Yeah, it's pusillanimous. It's lacking courage and being cowardly and being feeble with weakness of mind. Yeah. It's our word of the day.
Do these people understand that they are triangulating?
Some of them do, but if they are stuck in their own world, if it is a disorder, then it is part of their whole repertoire of what their behavior is like. So even like borderline psychopaths, so they manipulate the environment to for themselves. So they have insight? That's what you're asking.
Yeah.
Some of them might not have that great an insight, especially for those that have Yeah, but they know this is something that they can do to get what they want.
They know they're good. They're good at getting people on their side, and they know that building that team will help their mission.
Yes.
If we come across a person like this, right? Particularly someone who's trying to get us on their side to alienate someone else.
Yes.
How do we help them?
Help. We just don't triangulate with them.
Yeah, you see, you can just wipe your hands.
Yeah. Why do you help them?
That doesn't solve the problem. They're just going to find someone else to come onto their side. What I'm saying is, how do we help these people? Is there a way to help them?
The thing is, sometimes
become a circle. We help them become a circle.
To hell with them. What do you want to help them some more?
exactly. No, these people are manipulated.
FD, he should have been a priest.
Yeah, but interesting, right? I like how Angel, she's really, really sharp. You know, it's that circle and the circle of trust and the circle of embrace, right? So you don't want the sharp edges, you want that circle. The problem is the one that is being triangulated may not know that he or she is being triangulated. So it may be a bit difficult to help when you don't even know that you're being drawn into that whole triangulation process.
Because a bit slow.
But
No.
But do only manipulative people triangulate? Can you be triangulated by someone you trust? You know, in certain situations. You can, right?
Of course you could.
Yeah,
So
you can put your trust in someone, and that's why you don't know that you're being triangulated. And nobody goes around with the labels on their forehead. I've got BPD, I've got NPD, I've got antisocial, you know. So you don't know who is out there and whether you are triangulated. And honestly, we do that playfully, like at the beginning of the whole session, right? We do that playfully, and I can go, Angel, you agree, right? You agree with me, right? And keep asking you for your agreement, maybe to just alienate the boys and say, oh, the boys are like that. Don't you agree, Angel? And, you know, they will suddenly feel like, oh, I'm an outcast. But because you trust me, you agree with me, but you feel a little bit uncomfortable. You don't quite know what it is, but you just agree with me.
Yeah, you can be gullible and have everyone on your side because
true,
they trust you and they're like, oh no, I want to be with this.
That's true.
This gullible individual.
But this sounds like it happens a lot with children as well. Triangulation.
As in,
No, on the playground, you
On
know,
the playground.
they're getting people on
In
their side in
school.
school. It's like that person said this, don't be their friend. That's triangulation, isn't it?
yeah. So, I mean, it's not that they are being cynical. The intent is very different.
Welcome back to The Big Show and The Big Show TV. We're talking about triangulation with Dr. Geraldine Tan.
Yeah, and we have a WhatsApp message that came in. This person would like to stay anonymous, and they'd like to tell Dr. Jerry that triangulation happens very frequently with in-laws as well. I've had experiences with in-laws who speak ill of one parent indirectly to the young child, despite both husband and wife getting on well and parenting well, and also because of different beliefs, trying to indirectly tell the kid that the parent doesn't share the same belief is a bad thing. Now, this even went down to the pet that they own. One owned cats and the other owned dogs, and questions had to be raised to the kids frequently which one they would like better because parents versus in-laws owned different pets.
Wow. Oh, no, that's really uncomfortable for the child to be in. Okay. So, you know, for the children, I'm glad that they bring it back to the parents. So open communication is very important in situations like that. You know, so if you hear from one side, make sure you clarify on the other side. Importantly, we don't make any commitments. So in this situation, best case would be for the child to just keep quiet. If you feel that you're being triangulated, don't react, you know, and don't give any commitment. So you don't agree with anything at that point in time. I know it is very difficult. because you feel compelled to reply the person. But the last thing you want is to reply and then this person use your words against you and or use your words against the other person or the other party and say, see, even she is in agreement with me, even he is in agreement with me, so you're the bad one. So we don't want that.
Okay. Don't take sides.
Yeah.
So Jerry, when it
this
comes to people who triangulate, there is no way to treat them. Because we're saying it's part of another disorder.
We can. So if so, we know NPD is a little bit difficult. Narcissistic personality disorder. They might not have the insight. They might not want to come forward. But disorders like borderline personality disorder, eating disorder, they can be in therapy. We can use different therapeutic methods to help them. The embrace or the circle of trust, the circle of embrace comes in as you work together with your therapist. Yeah, so that is definitely possible.
But like I said, it's always connected to some other condition.
Triangulation.
Yeah.
Well, when it is so severe, yes,
It's always part of
We are
another
still talking about the
condition.
parents, right?
Yeah, but
right now.
triangulation
Whether
can
it's
can
parents-
just be a manipulative, insecure
Exactly,
person
yeah.
without a disorder, right?
That's what I'm saying.
So it's not a disorder.
So it can be they can have a disorder. They need not have a disorder for triangulation to occur.
Okay.
They could just be bad people.
Yes, exactly. It could
Yeah.
just be people that, manipulate.
You should use shock
now
therapy
we
on them,
know.
actually.
No. But now we know what triangulation looks like. If we feel that we are in that position, step back, step away, because the one that is being triangulated sometimes doubt themselves. So you do need to check in with other people and have emotional support for yourself.
Okay.
Okay.
Got it.
My
Don't
God.
isolate yourself.
It's a complicated world we
I
live
know.
in.
It's a
very
It's
complicated world.
complicated. Lots
Too
of terrible
complicated.
people out there.
Okay. Anyway, thank you very much, Jerry, for joining us this morning. Any last
No
words?
worries. Yes, and for those that are feeling very triangulated, realize that they have been triangulated and angry. Here's what someone, I don't know who said this, but he says, a wise man was asked, what is anger? He gave a beautiful answer. It is punishment you give to yourself for somebody else's mistake.
Okay. Before we let you go, I do believe we have a question
Question of the day.
of the day. Go ahead.
Yes. Our question of the day is, when did Changi Airport open?
Ew. Okay.
When
All
did
right.
Changi Airport open? It's scrolling across the bottom of your screen right now.
Yeah, all you have to do is go to Facebook or YouTube, type in your answer there, and you could win for yourself a radio frequency treatment worth $388 from Follicle Hair Spa and Salon.
All right. Thank you very much, Jerry, for joining us.
Bye. See you next week.
All right. Take
Bye-bye.
care.